In the current trial, we've so far analysed 14 patients treated at Baylor and 23 patients treated at the University of North Carolina, and we have a very encouraging overall response rate that's more than 70%. This is the first time we've seen such a high response rate with a CAR that doesn't target a classic B-cell antigen such as CD19 or BCMA. So I think that's exciting. And I think it's also an exciting option for patients with Hodgkin's disease who really have failed all the other new therapies that are available.
The trials have shown these really fantastic response rates in patients who have been very heavily pretreated and whose lymphoma has progressed through a number of lines of conventional chemotherapy and novel agents. And so this is really practice changing in that these patients really didn't have a lot of great options in terms of having not just responses but durable responses, something that can actually make this lymphoma go away. So I think that this is very exciting data and hopefully holds true in the future. I think one of the great things about CD30 CAR T-cell therapy that has been shown in the clinical trials from UNC and Baylor is the toxicity profile. So the cytokine release syndrome has not been greater than grade 1. It has had no significant neurotoxicity, and that is a significant contributor to not only quality of life for patients, but how long they have to stay in the hospital.
Most of the patients so far have had classic Hodgkin's disease because that's the lymphoma where all the patients' tumour cells express CD30, but there's a number of other lymphomas, several types of T-cell lymphoma, even some NKT lymphoma and some B-cell lymphoma where CD30 is also expressed on the lymphoma cell surface. So these would be obvious targets to look at too.